having a baby, your body changes. But for Allison Metter, she went to the doctor after realizing something wasn't quite right.
So there was some abnormal blood in my stool. Of course, they thought it was probably hemorrhoids from giving birth and pushing. But then after a colonoscopy, I was diagnosed with ulcerative colitis.
Allison said she had never heard of the condition, but she says living with colitis can be uncomfortable.
Not really bloating, sometimes stomach pain, really extreme fatigue, which I think is due to blood loss, right? Stomach pain, urgency to go to the bathroom is mostly the big thing, and fatigue.
Allison says she's now in remission thanks to her medication. Mercy Medical Center doctor Raymond Cross says he usually sees women get diagnosed between the ages of 15 and 35, and he says for people with more severe symptoms, there are other treatment options.
Often patients with severe symptoms are treated with steroids initially. Steroids are not a maintenance therapy, so they're used to get the symptoms under control and transition to something else.
Dr. Cross says treatment has come a long way, and maybe 10 to 20% of people end up having surgery. He says stress can be a trigger, so patients really need to follow the rules.
The most important things for patients are to come for regular monitoring with your physician and to take your medicines 80% of the time or more. If you do that, that covers it.
Dr. Cross says that he tells patients to eat a heart-healthy diet, exercise, and get good rest.
It's a lot of ups and downs, so it depends on the day, really. But now I know when it's coming. I can tell, so I try to be a little proactive to kind of knock it out, call him right away to help me not go down a really bad road.
In Baltimore, Lacey Griffith, WBAL TV 11 News.